Bismillahirrahmanirrahim. Today we will discuss about the intestinal obstruction. Obstruction of GIT may occur at any level from the stomach to the rectum, but most commonly the small intestine is obstructed. And the causes of intestinal obstruction includes most commonly hernias, adhesions, valvulus, interception, and tumors and infarction of the intestine. So most of the cases, they are due to hernias, intestinal adhesions, interception, and valvulus. They account for 80% of mechanical obstructions, and tumors and infarction account for the rest of the cases. So, few words about these causes, that is hernias. So, hernias are the protrusions of the peritoneum and sometimes with the intestine into the weak points. For example, inguinal hernias, inguinal canal, femoral canal, umbilical areas are scars, and there is protrusion of the hernia sac, formation of hernia sac along with the mesentery and sometimes intestine. And these may sometimes strangulate, that is obstruction of the arterial supply, and there will be strangulation of the hernia. Valvulus is when there is a twist of a segment of the intestine, and there is obstruction of the intestine. Interception is telescoping of one segment of intestine into another segment, and it is the most common cause of intestinal obstruction in neonates at up to the age of 2 years. And interception was a university question in the last professional. There was a clinical scenario, and then you have to write a diagnosis and then the clinical morphology and etc. Then there are tumors of the intestine which can obstruct the lumen of the intestine, like polyps or adenocarcinoma. And then is intestinal infarction, which may present with intestinal obstruction. Common symptoms of intestinal obstruction, they include abdominal distension, abdominal pain, and then constipation. That is absolute constipation. That is no passage of stool or flatus. That is called absolute constipation.
PowerPoint slide show.
So then is ischemic bowel disease. So there are 3 types of intestinal infarction. One is mucosal, second is mural, and third is transmural. Mucosal is when there is only involvement of the mucosa of the intestine. Mural is when there is involvement of the submucosa along with mucosa. And transmural means full thickness of the intestine is involved by the infarction. Transmural, mucosa, submucosa, and muscularis. So all 3 layers are is affected. The causes of ischemic bowel disease, they are most commonly advanced atherosclerosis, aneurysm of the aorta, then hypercoagulable states, oral contraceptives are sometimes embolus from cardiac vegetations. Then there are certain generalized conditions which can lead to intestinal obstruction due to infarction, that is cardiac failure, shock, dehydration, then vasculitis, that is polyarteritis nodosa, Wegener's granulomatosis, and Inaction purpura. So all these can lead to infarction of the intestine. So this diagram shows you the three types of intestinal infarction, that is mucosal and mural and transmural. So you can see that mucosal infarction only is limited to the mucosa of the intestine. And then mural infarction, and there is involvement of the submucosa along with mucosal involvement. And the third is transmural infarction. So here you can see the full thickness of the wall of intestinal involvement. So transmural infarction. So pathogenesis of infarction. So there are two types of injuries. So first is hypoxic injury. When there is hypoxia, there will be mucosal damage and there is sloughing and injury to the mucosal epithelial cells. And when the perfusion is restored, that is, there is reperfusion injury, there will be free radical formation, and then there will be neutrophilic infiltration and secretion of various inflammatory mediators. So morphology of intestine in infarction. The mucosa is hemorrhagic, ulcerated and dark red in color or purple. And the wall is thickened by edema fluid, and edema fluid will be present in the mucosa, submucosa and muscularis. And under the microscope, there is atrophy or sloughing of the surface epithelium, and the crypts are hyperplastic, and there is neutrophilic infiltration. So here you can see the infarction of intestine, cross appearance, cut section of the intestine. So there are areas of hemorrhages and sloughing of the mucosa and ulceration. So this is the microscopic appearance. Mucosa has been sloughed and there are hemorrhages in the submucosa, and there is coagulative type of necrosis of the muscle and submucosa